Hi, and welcome to Strengthen Your Heart event. I'm so excited for everybody to be here with me today. We're going to learn a lot about the cardiorespiratory system and what it means for our fitness, what it means for our heart. And as always, I just like to dive right in and get in there. So we're going to be talking about cardio, which basically represents the heart, and respiratory, which is basically our breathing, the benefits of aerobic fitness, also known as cardiorespiratory fitness. So you're going to hear me say CRF a lot. So that's cardiorespiratory fitness, and we're going to talk about what that is, how to measure it, why is it important, and all of the various testing methods that there are to measuring your CRF. And also, we are going to talk about some science behind why some particular foods over others might have a heart healthy boost. So that's going to be kind of fun. All right. So we're just going to get right into the cardiovascular system and what we know already about the cardiovascular system. So it's controlled by the heart, and it includes veins, capillaries, arteries, and it's the primary function to pump blood and deliver oxygen to the body, to our muscles, to all of the tissues, to our brain. We had a brain event not too long ago and talked about how important it is to be delivering oxygen to the brain. So why this is so important for blood to just circulate everywhere in the body is because the blood has nutrients, and it delivers nutrients to the cells. So we have the blood, and then it kind of just the blood kind of disperses nutrients to all of the cells, to the organs, and it really helps repair, rejuvenate, and keep us functioning as human beings. So what the circular system does, what the cardiovascular system does, is it also helps meet the demands of our activity. That's any activity, but it particularly it's emphasized with exercise. Okay, and it also has a lot to do with stress. So the less we move, the less the circulatory system moves, and then it puts more stress and it puts more strain on the heart, because the heart's like, oh, I gotta pump out this blood, and things aren't moving, things are kind of stagnant. Okay, so we really want this very free flowing circulatory system to be vital and healthy and just work through our body. It also helps maintain body temperature. And like I said, good circulation just helps heal the body faster, especially in places where there's not a major artery like the feet. Sometimes as we get older, we have certain conditions, we notice that we just don't heal as quickly as we did before. When we have a good cardiovascular system, when we have good blood flow, when we have good oxygen going through us, then things just seem to work a little bit better for us. So that's the cardiovascular system. Very simplified term there, our response for that. So let's talk about the respiratory system. That's our breathing. All right, it's really controlled by the lungs. It includes the nose, the mouth, the diaphragm. I talk about the diaphragm a lot when I talk about breathing, and usually it's in reference to stress management. So oxygen is really, really, really important because it just hits all sorts of different areas of health when it comes. Oxygen just hits all of these different health areas. So the primary function is to transfer oxygen to the blood. We need oxygenated blood. So we breathe in air and it goes to our lungs, and then it oxygenates the blood in our heart. So our heart can pump out all this wonderful oxygenated blood and nutrients to everywhere in the body, to our muscles, to our organs. And what's really spectacular is that it's super important, because when we receive quality oxygen, it is vital to our health. Without oxygen, without the proper supply of oxygen, our body will start to break down. Our body suffers. We need that constant supply of quality oxygen. So we talked about the cardiovascular system in a nutshell, the respiratory system. All right, so now we're going to put those together, and we're going to talk about cardiorespiratory. So the heart's pumping and we're breathing. All right. So there's something called cardiorespiratory fitness, and it's basically the measure of how well this oxygen transports and gets utilized in our body for exercise, how well our muscles are able to utilize the exercise and then pump out energy, pump out what's called ATP. All right, and that's works on a cellular function. Now we're talking about the mitochondria of the cell, which is the energy system, produces ATP. We get energy from it. So when we're exercising, when we're working our heart, when we're breathing really fast, you know, it's how well our body is using all of this exercise, all of this oxygen. So there's a fitness measurement to that. So just like there's a measurement for strength, if we lift so much weights, we can determine how strong we are. All right, that's a measurement. So the same thing goes with cardiorespiratory fitness. It measures how well your body tolerates exercise, how well your heart and your respiratory system is utilizing all of this oxygen to pump out more energy for continued aerobic exercise. Okay, so how well do we tolerate exercise? Exercise capacity, aerobic fitness. These are all sort of the terms for cardiorespiratory fitness. Okay, and there's also a link down here below that kind of talks a little bit about CRF if you're wanting to know more about it. It can get quite in depth. But here's a really good graph just to kind of show you in a nutshell about, okay, so here's another word, VO2 max. It's another measurement for oxygen getting utilized in the body. So many of you have heard of VO2 or a VO2 measurement or a VO2 max. And so it's just another measurement of understanding how well aerobically fit you are. Okay, so if you're not so aerobically fit, you're going to have a lower VO2 max, and it's going to take you, you have to use a lot more energy to do the same amount of work as if if you had a higher VO2 max. Okay, so there's a picture of two people. Okay, they're on the stairs. One person, just the aerobic capacity, their exercise tolerance is just lower. They're not able to use that oxygen efficiently enough to produce more energy. So they're on the same amount of step as the other girl, but they're just tired. They're working harder. They might be sweating more. They're breathing harder. As where if you're able to efficiently use that oxygen to your muscles to produce energy, like the higher lady with the VO2 max, you're going. You're like, oh yeah, I'm walking up these steps and it's no problem. I'm getting kind of tired, but I'm good. All right. So that's what we're talking about here. Lower exercise capacity, more efficient exercise capacity. Okay. Why does this matter so much? Why are we talking about this? Well, because we want to be healthy. We want to lead healthier lives. We want to do what we can to live as long as possible. We want to do what we can to live as healthy as possible for as long as possible. We want to be independent as possible for the amount of time that we have, right? That's the ultimate goal. So healthy adults who are the least fit have a mortality risk that's 4.5 times that of a fit. All right, so that's a really strong indicator. That's a strong predictor of mortality. Well, if you're sedentary and you're not getting that aerobic capacity in, and you're really inefficient, then that's up there with smoking and high blood pressure and cholesterol and diabetes. Some people even think that it's even a stronger indicator and predictor than some of these other risks for cardiovascular disease. So that's huge. That's a bold, bold statement. Okay, so where am I getting this from? I'm trying to, let's see, I might have to get out of here. Okay, I feel a little bit funny about getting out of the PowerPoint, but this comes from the American Heart Association. 2016, they talked about how cardiovascular fitness needs to be a vital sign. Just like you get your weight into the doctor's office, you get your blood pressure, you get your blood sugar tested. They're looking at the cardiovascular fitness portion as another predictor and risk indicator for cardiovascular disease. Okay, so we'll talk about that here in a minute, but let's go with the benefits. Why do we want to have better aerobic exercise other than just the fear-based, oh, I might die sooner? So this is, we talked about preventing stress. When you're getting enough oxygen in the body, you're expending a certain amount of energy that's very, that relieves stress. Aerobic activity burns calories. It's all about breathing to burn calories. So you can lose weight. It's an energy booster. Again, you're getting that blood flow. It increases your metabolism. It controls your blood pressure. The vessels, when you exercise, your blood vessels dilate. They become more flexible. So you have this beautiful reaction when you exercise of just this beautiful dilation of the blood vessels. And then they become more responsive. It helps with managing diabetes because you're using up all of that energy, all of that sugar, and the insulin receptors can become more sensitive. You're exercising. It's good for regulating heart health, and it promotes brain growth. We did talk about this in the other event. So not only are you getting oxygen and blood flow, but you're also using all of these major muscle neurons in your body. I mean, your major muscle units. You're using these units, and your head's going, okay, my toes are moving, my knees are moving, my arms are moving, and it's just firing off all of these neurons because you're doing so much body activity that your brain is very, very active. So that's really nice. We get some brain growth in there. Okay, here we go again. Evidence shows more active and fit individuals tend to develop less coronary heart disease than their sedentary counterparts. If they do get cardio heart disease, it tends to be later on and less severe. Well, that's nice. So sometimes we have a genetic disposition, or it's just it's kind of a cultural society. We have this. This is this is what's happening right now. But if you can delay that or even lessen the severity of the experience, that's huge. That is definitely worth getting your heart rate up for, right? So we've been talking about the benefits of exercise. We're talking about why you want to exercise. And then there's this sort of fitness level that you're supposed to be at. That requires more or less a test. So we want to get tested for cardiovascular fitness for one, just because it is directly related to our health as an individual. Cardiorespiratory fitness essentially equals health. So, and again, it is being considered. It's not right now, but there's more and more advocacy towards a CRF measurement being a valid vital sign, just as valid as heart rate, blood pressure, oxygen, weight, all of that. So there's a really strong push in that direction. And the American Heart Association is already asking clinicians to be doing this. Measure this. You measure waist circumference, measure their CRF. So, and that's because low CRF is an independent predictor for cardiovascular disease and all causes of mortality. So this is really huge. This is really, really important. And more research is just opening up about how important this is. Okay, and then again, higher CRF, higher VRR2s is associated with greater wellness and longevity. That's really nice. We want that. What kind of testing are we talking about here? Test matters. Okay, fine. What kind of testing? Well, we'll talk about VO2 test types first. So the gold standard is a VO2 max test. This is usually you go to your cardiologist for this. Some of us have taken this test. It's laboratory controlled. There's a lot of sophisticated equipment that goes with this. You can see this guy is called a Lab Max test right here. And this guy is hooked up to all of this equipment. They're literally measuring the oxygen flow in and out. And then it looks like this guy's on a treadmill and he's just going on that treadmill, and he's exercising literally to his maximum effort, which means that he is, after being on that treadmill, he's absolutely exhausted. So that's the gold standard. That's when you're going to get a really, really good indicator of what your aerobic level is. Okay, but that's not going to happen for most of us, nor do we want that. None of us actually really want to do that test. That sounds really tedious. So the more popular ones are the submaximal VO2 tests. Now, if you've been with Morris Health when you first started the concierge practice, we had a machine in here that was a submaximal VO2 machine. Some of you remember this. I hooked you up to this breathing machine, and I put all these electronodes on you, and you had to step up and down for 3 minutes. And you had to do all this resting stuff. So that is more like a submax VO2, but you can actually do this on your own. So there's a couple of ways if you're interested. I don't have enough time to explain it here, but if you're interested, I can get you a couple of tests and you can do this on your own. And it is submax. It's about 85% of your heart rate max. So you're making a good effort, but it's not super, super strenuous. And it's good enough. It's very much less invasive. So it's good enough to do on your own. All right. And then if you see here, there's this lady on the step, and she's just kind of stepping up and down. That's the test that I do when you get a fitness assessment with me. That is a version of a submax VO2. I am trying to get to 85% of your heart rate. And I'm also looking at how well you recover from exercise. So I'm looking at your heart rate, I'm looking at your oxygen levels, and I'm looking at you as a person. How well are you doing with exercise? Okay, so how well are you recovering from a bout of exercise? So you've done that with me, and that's a pretty decent exercise. So we're already ahead of the game. If you're here with Morris Health, and well, all of you are, and if you've gotten the assessment, fitness assessment done with me, then you've had an assessment for cardiorespiratory fitness, because I helped you do that. All right. There's also a non-exercise estimation, and that one, it used to be the least accurate, because you kind of have to guess. You type in this formula, and you put in your age, your weight, your height, and then you have to guess what kind of activities you get. Okay, or where you're at. Are you sedentary, or are you really active? And so, like, there's the system, and you plug it in, and it's kind of the least accurate. However, there's more and more technology out there, the Fitbits, the Garmins, the Polars, and they're becoming much more sophisticated. So if you have something on your Fitbit and it says VO2, or it says exercise capacity, or METs even, you're looking at your cardiorespiratory fitness. And I bet you it's probably gonna be good enough. You still wanna come in and get a test with me, but it'll give you a pretty decent ballpark of where you're at. Okay, so if you're like, okay, Heather, what in the world is a VO2, and what number am I even looking at to know if I'm good or not good? So you can go here, you can kind of pick if you're male or female. You can go to your Fitbit right now if you have it. You can probably look it up. But this is what we used when we actually had a submaximal VO2 machine here in the office. These we used a somewhat different calculation. If you just Google this, you're not going to get males in their 80s. Okay, so this is something that I have that's probably difficult to find if you just Google it. So just call me or email me, and we can talk about this a little bit if that's something that you're interested in. If you've had a fitness assessment with me, those numbers are on there. And it might say, like, you know, if you're a female in your 80s and you got, you know, an 18 on your VO2, then you're doing probably okay. So if there's any questions about that, call me. But if you've had a fitness assessment, I go over this with everybody. So there's that. How do you get a good VO2 number? So how do we make it better? Can we make it better? Well, the American College of Sports Medicine prescription guidelines say that you need about 150 minutes a week of moderate exercise. Okay, well, that's nice. What in the world does that mean? It's very, very, very general. And then they go on to say something like you can just start with 5 minutes and then everything adds up, and that you should count your, you know, walking in the parking lot, and that you should count everything. So it's so generalized that it's really hard to monitor if you're getting enough aerobic activity to progress, to actually start progressing with your cardiorespiratory fitness, so you can help prevent heart disease, or so that you can just at least reduce the severity if you already have something like cardiovascular disease. So we're going to talk about what exactly The measurements are what moderate intensity actually means for you, not for the person next to you, not for the person down the street, but for you specifically. So let's get into this. One of the measuring systems for aerobic intensity, that's how hard you're working. So aerobic exercise is continuous exercise. You don't stop. Like lifting a weight, you can like do a set and then you stop, you rest. Aerobic exercise is riding a bike, walking, swimming, walking your dog, going on one of those like foot cyclers. It's something that you do very, very continuous, and you just kind of keep on doing it until you get kind of tired and then you stop. Okay, that's aerobic exercise. So there's something that's called METs, and if you have a treadmill or a bike or your Fitbit, this will actually pull up. So a MET is just, it represents how much oxygen is being utilized at rest. So what have I got here? 3.5 milligrams per kilograms per minute used, approximately. So, okay, so we're talking about oxygen, right? Yes, we are talking about oxygen and what's required, how much oxygen is required in the body at rest. So that would be 1 MET. If you're sitting, if you're lying down, resting, like taking a nap, that's 1 MET. Okay. If you're sitting on the couch, maybe you're kind of moving your feet around or you're fidgeting or squirming a little bit, that's 2 METs. Okay, because you're using just a little bit more oxygen than you were when you were completely lying down taking a nap. So if you get up and you walk around the house, that like maybe continuously, like maybe you're just going into every room, maybe you're putting stuff away, folding laundry, putting it away in drawers and stuff like that, then you're using about 3 METs. So this is a measure of exercise intensity. So let's go to our handout. If you have this handout right here that you printed out, if you don't, that's okay. You can always pick one up in the office. That's fine too. So you definitely want to read about the importance of cardiovascular fitness, which is the first article. And then let's actually go to page 7. We'll go to page 7. Okay. So it's called The Layman's Guide to METs. So it's the metabolic equivalent of sitting. Sitting is basically 1.5, something like that. And then after that, the METs go up. So if you're walking your dog, if you're going on a bike ride, maybe like just on a flat road, you're just kind of cruising, not a whole lot of energy is expended, then that's maybe like a 4. So so you kind of get what I'm saying here. The more difficult the continuous aerobic exercise, the more energy you're expending, the harder you're going to be breathing. So if you're lying down, you're not going to be breathing that hard. You get up, you start walking around, you're going to be breathing a little bit harder. Those are calories being burned, that's oxygen being utilized in the body. Okay, so you can read about the layman's guide here, and then let's go here. So these are home activities that you can kind of see what the intensity level is. And so we're looking for moderate intensity because that's where we need to be. So the 1 through 3, that's too light. If you're just kind of walking around your house and that's nice, you should be getting up, walking around. But if you're not like breathing and you're like, wow, like I'm kind of feel like I'm, doing a whole lot of other stuff, then then it's just too light. You really need to be maybe not only walking, but maybe you need to be doing like maybe a couple squats in there, like walk around and then do a couple chair squats and then walk around again and do a couple chair squats. That might be sufficient enough to be like, okay, I hit a certain amount of moderate intensity. Okay, so then you can kind of look at this and see where you're at. So if you're playing with your dog every day and you're throwing the ball and you're kind of walk around and you're getting down and petting your dog, then you might be getting that moderate intensity. Washing your car does that. Playing with the grandkids, now you start doing some, fast and go stuff. And so that starts getting even more intense. So it's just, the reason why I'm saying this is because it kind of lets you know where you're at as far as every day goes. So you have your steps, people count steps, but that's not necessarily intensity. We really, really need it to be thinking about our heart and about our breathing. Is our heart rate going up? Are we breathing more heavily? Okay, that's what we need to be thinking about. All right. So you might also be saying like, well, okay, Heather, I get what you're saying, but I already have metabolic disease. I already have cardiovascular disease. Like I'm not going to be getting down on the floor. I have knee surgeries that, or something like that. So this just kind of shows you that any activity is good. So I'm not knocking activity at all. I'm just saying that the intensity of the activity has greater benefits. But if you look at this chart is associating MET activities with minutes. And there's a huge slope that goes down as far as relative risk of mortality. I mean, it goes down quite a bit with just even a little bit more activity than what you've been doing so far. So that's kind of cool. And then it just kind of slowly starts to go down even more with the more aerobic activity that you're getting. If you don't have cardiovascular disease, again, that's a huge dip down. You just did yourself a huge favor by getting up and doing a little bit more physical activity. And it doesn't have to be walking, swimming, biking. It really, really doesn't. I have a mini challenge that I'll be talking about. And a lot of it's just low impact. If you're getting your heart rate up to a moderate level and you're breathing sufficiently enough, you're working your cardiovascular system, you're working your respiratory system. Okay, and that's why we get to this. This is my favorite. You probably heard me talk about this a lot when I talk about exercise in my health coaching sessions. This is rate of perceived exertion. And let's find out, okay, we're looking at page 5 and 6. Let's do page 6. That's this one, right there. They got the emoji faces. Okay, it's just a bigger piece of paper than on the screen. Okay, so this, I'm getting excited. This is probably one of the better ways to rate your intensity levels. It's no equipment. You don't have to measure your heart rate. You don't need any fancy equipment. All you need to do is just check in with yourself and say, where am I at right now? Okay, so there's one is sleeping. If you look, it's like that guy just snoozing. That's number 1. So you're watching TV, right? You're asleep. Nothing's happening. That's the one that you're right. Rate of perceived exertion, that's not happening. Okay, so you get up, you kind of maybe leisurely walk around a little bit. Now you're at 2. You can sing. You're not exhausted at all. Rate of perceived exertion, it's not where we need to be, right? Okay, so let's go to 3. So 3 is, all right, I got outside. I kind of moved my flower pots, I watered them, I even started sweeping the back porch a little bit, and I'm good. Like I can tell that I'm moving, but I can still kind of, like if you wanted to hum a tune, you could hum a tune. So you're still good. Rate of perceived exertion, if you probably did that for a little bit longer, then you might get to a moderate level, okay? So let's say you got off the couch and you're sweeping your back porch and you notice that, oh, there's leaves, I got a rake. So you get out the rake and you start raking leaves and you're putting them in piles and then you're putting them in bags. And now you're starting to be like, wow, you have to kind of take some deep breaths in there, just a little bit. You're still good. Now we're getting into moderate intensity. That's what we're looking at. So now you start your minutes. I am there. I've been doing that for 5 minutes. Okay, now that's good. Okay, so you can't really count like walking to the backyard, but once you start moving around and start getting your heart rate going, and you get to like maybe that level 3 or that level 4, then you can start counting those minutes because you're at that level of exertion. So so that's what that's at, and you don't need anything for it. Okay, so if you're like, okay, Heather, that's nice, I hear a lot about heart rate, but I'm on a beta blocker, or my heart rate just doesn't do a whole lot. It doesn't seem to react the way that normal heart rates go, or something like that. Then you can go to this Borg scale, and this Borg scale is what page? 5. This is the guy who invented the scale. His name is Borg, and so you can look. This is a rate of perceived exertion that looks a little bit different. You're going to see bowl scales. If you're at a gym, you're going to see the Borg scale, and it's going to say 6. 6 is the top number, all the way down to 20. All right, but it still gives you a description. So 6 is like 1 met, so it's kind of like the opposite. So it's 1 met, and it's rest. 7 is extremely light, and then it goes down to max exertion, and we're not going to go there. We're going to be somewhere around somewhat hard. Okay, so we're going to keep that heart rate max. We're going to keep that percentage of heart rate from like 60 to 85. If you already have cardiovascular disease or heart disease, or maybe metabolic disease, you're going to want to stay at the lower rate. You're going to want the 65%, or COPD, you're going to want the 60%. So you stay on the lighter side. Okay, once you get accustomed to it, you can progress. That's what it's all about, is progressing to the next level, so you can become efficient with exercise. So your heart become more efficient, your circulatory become more efficient. That's why we're doing this. So say your rate of perceived exertion is, let's say, 13. 13 on the Borg scale, the description is somewhat hard. If we were to look at the rate of exertion, it would be like a 5 or a 6, where it's kind of like maybe you're sweating a little bit. You're definitely breathing hard. You know that you're working. Okay, and if you wanted to estimate your percentage of heart rate, then you would go over here. Well, you might already be at the 70 to 80% of your heart rate max. Okay, and that's a good place to be. And you can kind of just keep it there. You don't need to be working any harder than you are. You don't necessarily want to be working less than you already are. you can kind of keep that pace. And keeping that pace kind of means like, okay, I'm at 80% and I don't want to go any higher. So then you kind of slow it down a little bit, but then you're also going to have to kind of pick it up a little bit, and you're going to go through like this range of 70 maybe to 85 to 70 to 85. And if you do that for 30 minutes, you are good. You are good with what you're doing. You're hitting all of the markers that you're supposed to be hitting. So it's a really good way to really take a lot of the guesswork out of that. You don't need fancy equipment. And what's beautiful about it too is that you're going on how you feel, which is like, yes. So you're not relying on numbers. You're not relying on, oh, I'm supposed to be here. You're not. You're really, really, really not. You know, if there's things going on, if there's obesity with metabolic conditions, with you know, breathing problems, then it's probably is just walking around the house, and you're going to get to that rate of exertion pretty quickly. And you know, it's going to take you 3 minutes instead of 10 minutes. That is where you need to be. Your body's telling you that. Your body is its own monitor. It's telling you that this is where you're at. So you don't need fancy equipment. You just need to listen to yourself and what you're doing, which is perfect. It's exactly what you should be doing. So these are just really, really fancy mechanisms. So I hope that was clear as mud. Anyhow, if you have any questions, of course, you can always email me and we can talk about this. If you haven't had a fitness assistant with me yet, please get it. Please get one. Please make an appointment, because that's going to be really valuable information. Let's move on. Let's move on and away from exercise, because there's still plenty of heart health to talk about. So I'm going to take a sip of my tea. Okay. Eating for heart health. Oh, huge. Diet is huge when it comes to heart health. Okay. So what we already know. We know that the Mediterranean diet and the DASH diet protocol are the major winners when it comes to heart health. All right. So it helps with weight loss, lowering blood pressure, increased vitamins and minerals and fiber and all of that beautiful stuff. And then it's also, when you add in all of the fresh fruits and vegetables, then you naturally decrease the processed foods, the excess fat, the extra sugar, the chips, what else? The processed meats, the candy bars, all of that goes away because you're bringing in all of this beautiful fruits and vegetables and fiber, and that's filling enough. Okay, the more vegetables you add in, the more you will naturally crowd out the processed foods. So that's good. Okay. So we know that, right? We know that we're supposed to eat our fruits and vegetables. So I really wanted to get into why. Why in the world am I supposed to eat Swiss chard? I'm not sure. Well, let's find out. So, so heart healthy foods is it's typically because they have a higher content of some sort of chemical makeup, which is beneficial for the heart, because all fruits and vegetables are pretty heart healthy. But what makes leafy greens super, super heart healthy, and especially something like Swiss chard, collard greens, and kale, is that they have higher levels of potassium. And this is really has to do a bunch of the science behind the DASH diet. And that's the higher levels of potassium help dilate the arterial walls. So we talked about exercise dilating the arterial walls? Well, food can do it too. So these leafy greens dilate, and then that just helps the blood flow right through. So it lowers blood pressure. The heart doesn't have to work so hard to pump that blood through like it can't get through. So so that's really, really cool. It also, potassium also helps release what's something called nitric oxide in the blood, and that helps create better circulation as well. So, so the DASH diet research shows that high potassium, along with magnesium, help dilate the arterial walls, helps lower blood pressure. That is along with a low sodium diet. So what do we know about high sodium diets? They make the artery walls stiff, so they can't be flexible. All right, so what happens if blood's trying to go through a very inflexible artery? It can't, high blood pressure. So reduce your sodium, and then the leafy greens help the arteries become a lot more flexible. Okay, so what page is that on? That is on page 9. So when it says 3 articles from Dr. Greger's site, Nutrition Facts, I got them all from his site because he's so wonderful about really looking at the science behind food. So the next one, on page 10, is beets. So I talked about beets before, I think in my last event, and we're going to talk about them again because they're really coming up as a superfood, if you want to call it that. And it's the nitrates. It's a natural, beets have a natural chemical called nitrates. And to make a really long story very short, it helps with blood flow, and it helps with blood pressure. It causes this whole chain reaction in the body, and it helps the oxygen become more efficient in our bloodstream, which is perfect because that's what we're trying to do with exercise. And there's a lot of research. If you click on those links that I have here in the handout, and it just shows you that there's been studies that beets and beet juice help with the efficiency of delivering oxygen through the system, and it helps with blood flow and blood pressure, and it increases stamina and endurance during exercise. So if we're out there exercising, why not eat a beet salad just to kind of help boost our heart health? And then we have flax seeds. We know that essential fatty acids are really, really good for heart health. It helps boost our HDL. That's a protective mechanism. And so flax seeds help increase our omega fatty acids. They also have anti-inflammatory properties. They also have fiber, so that lowers the cholesterol, and it's supposed to help maintain blood sugar levels too. And there's just some really wonderful articles about the benefits of flaxseed, and it's really, really easy. It's sort of strange to get into the diet at first, like, what, flaxseed? So what do I do with this weird seed? You can't really eat it like you can a pumpkin seed because it becomes gelatinous. So you eat it, and it's kind of like a chia seed. It just like kind of gets stuck in your teeth. You're like, oh, what is this? But if you, let's see, Mary's crackers. Is it Mary's crackers? Have flaxseed in them, and those are kind of fun. I like to ground up flax seeds and put them in my baked goods. If I make homemade muffins or homemade cookies, I ground it up myself, and I add the ground flax seeds in there, and that's just an added boost to help with the fiber and the cholesterol and the omega-3 fatty acids. So if you're like, wow, Heather, I think I kind of want to know some more recipes that have flax seeds, please email me, because I have a lot. And if you or in the office anytime, we have Dr. Greger's books, and he has plenty of recipes that have flaxseed in them and have beets in them too. You can make a beet smoothie. I've done that before. It's kind of fun. So, so those are definitely some things that you can do to help give yourself an extra heart healthy boost. There's science behind it, so it's not, you know, just not saying this for fun. And I think that's it. That is the end of the PowerPoint presentation. So I was talking to Colleen a few months back, and I said, you know, I have these events, these presentations, and it's all of this information, but then what happens to this information? Some people apply it, or it kind of gets forgotten, or just kind of gets put on the back burner as something nice to know. And I said, you know, we really need to solidify this information. We really need to put this into practice, like right away. Like we get it, we absorb it, we put it into practice, and that's how we actually truly learn something. So it's not just hearing and seeing, there's doing. So that's when we came up with our 7-day mini challenges. So this one correlates with the cardiorespiratory fitness. We have, Colleen and I put together what's called the 7-day heart fitness mini challenge. And it's this packet right here, and we're gonna have a sign-up sheet. You can sign up RSVP just like you do for the event, and you get this packet, and it talks about how to improve your cardiovascular fitness. Woohoo! So the rules, how this goes, is that it's up to 3 minutes of exercise, right? Because everybody's busy. We talked about how retirement is not relaxing. Everybody is busy. So I made this super simple and super easy. For more sedentary people, maybe have a heart condition, you're going to go to the 60–70% of your heart rate max. So you're looking at maybe 3 mets, maybe 3.5. So where you're still breathing, you're breathing more, but you're still relatively comfortable. Okay. For the moderate exercisers who already do aerobic exercise, you're going to go to 70–85% of your heart rate max. You're going around 4 to 6 mets. And now you guys know what that is, because we just had a whole beautiful presentation about it. So and then we're gonna measure, which is really, really fun. So we're gonna see if any improvement has been done through the 7-day mini challenge. So we'll talk about measuring your cardiorespiratory fitness. Yay! So if you're super excited about that, let me know. We'll get that all set up for you. This is the end of the presentation, so I'm going to go ahead and just get out of here.